Hello, everybody. I just want to see whether you can hear me. And this is Andrew Lau. Can you hear me now? Can you hear the sound at all? Can you give me a yes, one, if you can hear me? Can you give me a sound, one? Can you hear me? Can you, okay, the music sounds good. Okay, excellent. I saw, wow, we have people from Hawaii, we have people from Hong Kong, we have people from Los Angeles. Wow, this is exciting. Well, how are you? Thank you very much for joining us for this very good information, because a lot of people, my customer had asking me about this issue. And that's why I thought that, well, it really is important to help them to better understand why they have this thing occur, this problem occur, and what is the solution. Hi， 我係 Angela Lowsutea President， 你好各位朋友。嗱，其實咧我今日好開心咧，可能夠講及一個好特別嘅問題咧，係好多人都有嘅。咁但係糖友同埋前期糖友都有，呢個先係特別。咁我唔知道原來咧喺我其實知道嘅，但係即係好多人咧就唔係咁 sensitive， 亦都唔敢講。咁我今次個webinar 咧係一個好好嘅 webinar， 幫助各位係更加了解呢啲咁嘅common 嘅問題。咁你可能夠正視咧，亦都可能夠即係點去處理啦。So I think this webinar will be very, very good to help you to understand what you need to do. And so I think that will be really good. So I'm going to start the webinar now. I'll bring my screen over and then we'll go from there. Hold on. Okay, can anybody see my screen? If you can you give me a 1? Everybody can see? Can you see the screen? Can everybody see the screen? Can you give me a 1? Can people see my screen? Can you give me a 1? Okay, let's see. Okay, can people any people in the group, can you see the screen? Can you give me a 1? No screen. Okay, let's see. Oh, okay, good. There you go. How about now? Anybody can see? Can you give me a 1? Okay, good. Excellent. Very good. Okay, now we are in business. Okay, good. Excellent. OK， 我係Andrew Lau，就講一次，我係 introduce 咗自己啦。咁我係Lowsutea 嘅 president 啦。咁我哋今日咧就講一個好特別嘅問題啦，就係好多糖友或者前期糖友都唔敢問醫生嘅。咁其實今日一個 program 係好特別嘅，即係俾到好多人咧有個機會多啲了解啊乜嘢叫做糖尿病嘅特別嘅問題。OK，today I'm Andrew Lau, Lowsutea president. I think many of you met me. And today we're very happy to see all of you, because I basically see a lot of people from Hong Kong, a lot of people from Singapore, a lot of people from Hawaii, a lot of people from also Australia, and also many people from Los Angeles and Vancouver. So it's very international, by the way. So it's really great. But it tells me that you're all interested to learn about why there is, issue in pre-diabetic or diabetic, and the problem of you being so embarrassed you don't actually ask the question to the doctor. And this is the reason why I actually designed this webinar, is because many of my own clients who are pre-diabetic and diabetic actually are saying that, hey, I have this problem, but I don't dare to ask my doctor. And they went to came to ask me, what is the solution? So net result of that, I basically felt, oh, maybe I should just design a webinar to help people to better understand, then go from there. 嗱，各位堂友，即係我今日咧係其實咧點解我要做呢個 webinar 咧？就係因為咧係個問題咧我哋好多堂友或者前期患病嘅堂友咧都話，喂，我有呢咁嘅問題，但係我又好尷尬問醫生喎。我唔 sure 係咪咁喎，咁所以變咗嚟講咧，其實係一個好大嘅問題出現嘅。咁如果係咁講嘅話咧，我哋就真係要正視下係咪我哋係能夠喺有機會咧幫手可以即係解釋，我用呢個 webinar 解釋晒好多嘢俾人聽。咁變咗嚟講咧，我哋咧就可以咧好快各位堂友或者前期患病者都有個 idea。然後咧知道點去問醫生 ，OK？ 咁今日個 webinar 就係咁嘅。咁但係有幾個好重要問題係一定要繼續即係了解嘅。嗱，但係我有兩張 slide 咧，幫助好多新嘅堂友入嚟咧，係能夠answer 佢嘅問題，未必即係 catch up 嗰陣時嗰啲 slides 啦。OK，I have a couple slides just to catch everybody up so people actually understand. So because we have a lot of new people comes in, I saw a bunch of them which I did not see them before. So I thought it would be good that at least get them to understand what it is of diabetic. Just catch 2 slides and from there we'll go on the regular meeting. Okay, so as you know, if you are diabetic, you actually having a blood sugar as entire blood vessel for your entire body. And your blood sugar, it gets so high, basically get medication, but don't forget, you never get well. You can only control. In other words, even you brought the blood sugar down from up and down, and then now you're only in control, but you cannot say, okay, I take some medication now, I can stop and go well. It won't go well. Now, though, even scarier because in the pre-diabetic, we have a lot of my clients are pre-diabetic. They have the A1C, which is in percentage, being 6.2, 6.3. And if they don't do anything, in 3 years, they will convert it to be a diabetic. Okay, that is a really true study that people actually say, wow, a lot of my customers say, I wish I see you 3 years ago because now I'm a diabetic. And their diabetes, unfortunately, because they didn't do much, their blood sugar continue to be high somewhere in the neighborhood 7, 8, and 9. So as time goes on, they will continue to get more and more medication because they never change the diet and never change the lifestyle. Okay? 嗱，各位朋友記住，如果你係有糖尿患病者嘅話咧，你係永遠都唔好嘅。其實就只係能夠有控制。嗱，控制咧，當你血糖係低過係6.5啊，咁就繼續會好啦。同埋 A1C 就低過6.5以下，或者有啲人就7啦，因為依家個 scale 高啲。如果老人家嘅話，咁邊樣嚟講咧，你就一定係要繼續控制嘅啫，唔可以就話我食啲藥咁啊，以後係咪會好翻㗎？唔會嘅，控制 ，OK。咁但係點控制咧？其實你就係控制你血糖，同埋咧你要做好你嘅改變你生活習慣，食嘢啊，或者係exercise 啊，control 你 weight 啊，呢啲全部都要做呢樣嘢嘅。同埋仲有一樣嘢，血糖咧只係你 find out 係乜嘢啊？你抽血 find out，所以好多人咧係 surprise 嘅，因為佢近時都冇抽血噶嘛。咁原來我有糖尿病㗎。咁如果前期患病咧仲弊，3年咧佢如果咩都唔做咧，真係會變咗糖尿病嘅。咁如果係有呢個前期患病者或者糖尿病，咁我係應該做啲咩咧？第一要控制個 diet。即係個食物啦，第二要做 exercise 啦，第二去 weight control 啦，即係磅數啦，同埋咧佢要繼續有時 track 你嘅血糖幾多。嗱，聽多啲講座咧，多啲了解，咁你就會了解點能夠控制。So if you are already diabetic or pre-diabetic, you really need to take action to change lifestyle, like dieting, like weight control, like exercising, and measure your blood sugar. But if you don't do that, you know what? Most likely you are going to be convert to diabetes. And those are kind of things that, you have to do it daily and continue to have a plan to do that. So the thing is, if you said diet, what that mean? Now, one of the very easy formula for you to follow is don't eat any white food. What is the white food? Like rice, or eat very little. Flour, potato, all these are considered white food. And so anything white food with high carb, and white bread, you cut it out as much as you can. So also you eliminate your soda, even diet soda, because diet soda fool your brain to say, I need sugar after you drink it, and you end up eat snack, it'll go worse. And juice, all the juice are practically are very sweet and most likely will jack up your sugar. And on top of that, you have to eat low glycemic type of fruits, such as kiwi, apple, things like that. So will help you lower blood sugar. 嗱，其實咧 diet 方面咧好重要嘅，其實好重要咧就記住一樣嘢，唔好食白粉，即係白粉即係咩？白麵包啦、飯啦，我食少啲啊，未必唔可以食，但係食少啲好少少，然後咧就食所有白粉啦，即係如果係麵粉啊嘅做嘅嘢啦，好似麵包啊，咁全部咧就係降低佢嘅，同埋咧唔好飲個汽水啦。因為汽水糖咧一定好高，一杯可樂360卡路里啊。咁第三咧就係飲 juice 果汁啦，咁嗰啲嘢就全部要降低或者唔飲。OK， 咁其實飲咩好啊？咁有一個好處咧就飲去糖茶啦。咁去糖茶咧，我哋就會俾到你能夠降低你依家嘅糖尿，同埋降低你嘅LDL 你個膽固醇，同埋咧你亦都可以能夠咧。detox 你個身體，咁所以變咗嚟講咧係排毒啊，咁所以變咗嚟講咧，你就會真係幫助你整體嘅身體。So you might ask, what kind of drinks do I drink then? Because there's nothing to drink. You can drink Lowsutea. After you drink Lowsutea, what it does is lower your blood sugar and continue to maintain your blood sugar level in like A1C with about 6.5 around the area. And on top of that, you also lower your LDL. And later on, I explain why the LDL is so important to you, and plus it detox. So actually, a lot of my customers now, they might not have diabetic, they are not pre-diabetic, but they have high cholesterol. They're drinking my Lowsutea to bring down their LDL. And I will explain why that's important. And now we'll find out even more interesting thing is, earlier, if you have high LDL with high sugar, net result, the next step will be your pre-diabetic, okay? So keep that in mind. Now, how does Lowsutea work? Basically, we have two ingredients in Lowsutea. One is the guava leaf, which is block the sugar into the vessels. And then you have bitter melon that will bring the sugar into the cells. So that's only two items in there. It's 100% natural and it's easy to drink. It's very delicious, and you just drink tea and you will bring down your blood sugar. And if you need any more information, write to me, send me a email at andydlau @gmail.com. So very easy. So if you don't do anything, what's going to happen? It affects your heart, it affects your vision, blur. And matter of fact, in December 19th, and for Hawaii, December 18th, we'll have a special lecture to talk about what diabetic affect your vision. Now, I tell you, many doctors will talk about that, and I found a professor to help you better understand eye disease of diabetic. And on top of that, you affect your kidney. Now, that is a big issue. 75% of Hong Kong kidney dialysis patients is what? Diabetes. Amazing. That's scary. And plus, there are a lot of people with stroke, nerve damage, and fluid circulation. So a lot of people now coming in and telling me, wow, I have all these problems. How can I resolve this problem? So we will learn a little more on that. So now let's go talk about the main topic today. Now, a lot of type 2 diabetic usually have this problem, a very embarrassing sometimes, and they will have this symptom. A lot of times they're really afraid to ask the doctor. Well, before I even start off that, I will tell you a story. 其實好多糖友咧已經係有好多問題咧，係好即係尷尬嘅東西出現㗎啦。咁但係佢又好 唔係好想問個醫生點解，或者唔想問醫生可唔可以能夠幫助佢哋。咁佢哋咧好多時去到 clinic 嗰度就唔敢問，咁就冇問到。咁其實咧有好多朋友即係打翻電話翻嚟俾我啦，或者係即係 email、WhatsApp 乜嘢都有嘅。咁佢哋問咧就係話哇，我哋真係好驚問醫生嘅喎，咁點算咧？咁同埋咧佢哋問好多答，所以今次嘅堂咧講呢樣嘢嘅。So one of the very common, majority of them has. I'll list out the bunch of them first, and then we'll explain one by one. Okay? The first thing is many of them has unavoidable urgency. They have to go to the restroom. They have to go void. They have to go shishi. Unfortunately, they have no restroom, so end up that they have start leaking. And so this is one of the most common problem for pre-diabetic even. And also lots of diabetes. Okay, that is the most common, and so keep that in mind. Secondly, unfortunately, men, as that's a big number, and a lot of people even call me and say, what can I do? A lot of men actually have erectile dysfunctions. In other words, they have no proper sex life. They can't even have a erection, so no sex life, basically. So that is something that will affect them, and we'll talk about that today. And some of them also said, well, I have a lot of bad breath. How can I do that? People can smell me. And so that kind of things that is kind of offensive. So that's, again, there's something that we need to address. And also the big toe tend to be quite discolor. It tend to be yellowish. And so, again, that is if they wear, a sandal or something, they see it. And so, wow, your toe doesn't look right. Worse that a lot of ladies has itch at the private parts, and it's very uncomfortable. And that's something we will address today. I know today's lesson might be somewhat embarrassing and maybe something that is, no one want to address, no one want to talk about, but we have to face it. So I will open the discussion in a way that no scare of other people, what happened. So at least we can ask about it. So that's why today, we have a lot of people from all over Asia, Pacific, United States, Hawaii, Vancouver asking. I think that's the reason. Okay, let me go back to the last previous slide. 嗱，好多堂友咧，其實咧就係話，哇！我最大嘅問題咧，我成日要去廁所，但係有陣時好急要去，但係又忍唔到喎，咁我就唯有少賴啦，或者去到嗰度賴啦，冇地方，咁點算啊？咁 OK。咁如果係咁樣話咧，變咗咧就好多朋友咧就會係有呢咁嘅問題咧，咁我哋要正視嘅。咁但係點解會係咁樣咧？我應該會再解釋深入啲。咁第二樣嘢咧個問題咧，點解有大概好多人咧30%差唔多係男士嘅堂友咧，佢拔起唔到啊，咁佢咪冇咗一個性生活咯。咁其實呢個係好慘嘅。咁但係咧，我哋都有啲即係要好早啲話俾醫生聽啦，等佢唔會去到呢個地方啦。咁呢個咧就我哋今日會講下嘅，同埋教即係有啲咩嚟睇到呢樣嘢啦，同埋有咩做咧可以做到呢樣嘢咧。咁同埋口臭咧，亦都係一個常見嘅問題嘅。咁我哋都會解釋點解會咁咧。咁然後咧就隻大腳趾公咧，成日變黃色，唔靚仔。咁如果你着啲即係 sandals 啊，咁啊見到曬，哇！咁好似好肉酸咁。咁我亦都會講下點解會變咗咁。其實呢個好正視嘅，因為如果唔係咧，如果你唔 take care 佢咧，可能變壞啦，你鋸咗佢啦，咁呢啲咁問題。咁仲有一個好問題，好多女士咧係會痕癢啊，尤其是個 private 嘅 area 痕癢咧就好慘啦。你唔知點樣，人咪喐下，唔知做乜咁，咁係好唔舒服。咁其實咧好多呢啲嘢咧，我哋可能夠幫助你咧。係幫助你可以變到係可以能夠令到你咧係可以改變咗呢啲咁嘅 symptom 啦。咁我哋繼續講落去啦。Now, why, if you ask, why suddenly I have to, wow, I have the urge, I have to go to the restroom, and I have to go shishi. Why? Okay, that is one of the most common problem for many of the pre-diabetic or also diabetic, type 2 diabetic. They need to urge, have to go. And that is very common. OK? 嗱，其實咧，呢個係最 common 嘅問題咧，就係忽然間我要去洗手間， 我好似好急要去嗱，呢樣嘢咧係一個好慘嘅，因為好多香港地方都未必有洗手間或者其他地方冇地方咁點算咧？咁可能即係急到賴嘅喎，即係跌漏咗啲出嚟喎，咁係一個好大嘅好多人一個好大嘅問題。咁所以變咗嚟咧，你要即係有計劃性去改變呢啲東西嘅。咁我應該會教你講 ，OK？Actually, you will be surprised this embarrassing situation. 89% of the diabetic for type 2 diabetic actually experience some kind of bladder dysfunction. In other words, their bladder are not functioning that well, so they tend to have problem is leakage and really just gotta go, and that is very common. 89%, that's a big number. And women has 2.5 times, and this is by their research on diabetes, always have urinary incontinence. And so that is, again, a very big number, 2.5 times more likely that they will have urinary incontinence. And the reason why they have that is because the diabetes actually damage the bladder of the nerve of the bladder. And also because of that, they have all of the high blood sugar. It actually affected because of the nerve damage. They become more frequency. I have to go urine, and they cannot retain the urine. And so net result, because they can't retain it, so I have to get it out. And if I have no place to go, guess what? I start getting leakage. So this is very, very true. And I'll give you a story after this, after I explain this, and that is just to relate any one of you having this problem. 嗱，其實咧呢個真係好多人都有，其實好多堂友都問我嘅點解啊咁。其實咧原來喺所有即係好多 study 裏邊咧，原來89% 嘅糖尿患病者第二型嘅人咧，佢哋個即係膀胱咧就會有好多機會咧係有唔妥嘅跡象出現嘅，有個即係功能障礙啊嗰啲咁嘢嘅。咁仲有女士咧仲更加慘，2.5%， 2.5倍嘅女士咧就有即係失禁嘅問題。咁失禁問題咧係常見嘅，佢係咪失禁好多？係 leak 出嚟少少咁啲出嚟，咁變咗啲人就話好 embarrassing 啊，唔想去街啊，或者係我要擺個紙巾喺度啊嗰啲咁東西。咁其實點解咧？因為咧糖尿病係 affect 佢個 nerve 啊嗰啲神經系統啊，咁個神經系統係控制個膀胱嘅神經系統啊，咁就好多時咧引起咧有幾樣嘢嘅。第一，膀胱發炎啦；第二咧就其實佢啲尿 hold 唔到啦，咁又失禁啦，要成日要走去啦。咁變咗嚟講咧，好多人咧就變咗咧係有呢個即係成日都哇好急要去，其實又唔好多尿，但係咧變咗嚟講咧，就去嘅時候咧去唔知咧就賴咗啲咁多出嚟。嗱，我講個故仔俾你啦，咁就我講完之後咧，咁你就了解係咪你都有呢個問題啦。So let me associate with you actually a story given by several of my customer client. They all about the same issue. 有個男士咧就話俾我聽個古仔嘅，咁我講英文之後，然後就 translate 中文啦，咁大家咧就有了解多啲。Actually, when a client came up, well, actually a few clients, the same story, but similar situation. They said, Andrew, I have a real issue. I said, why? He said, I always suddenly have to go. I have to go. And when I have to go, at the end of the day, my urine come out is not that much, but I really had to go. And so I end up, I always put a tissue on my underwear, inside my underwear. If I have to go, leakage, I won't get so much out and spoil my underwear. And I can't do much about it. It has been about so many months already. And these people, I asked them, how long you have diabetes? They have only 1 or 2 years. They're not long. They're not years of diabetes. So I said, wow, that is a real problem. And women are the same thing. So, really, at the end of the day, I found majority of our customer who women also found that they also leak, so they put a tissue on the panties, so in case they leak, they won't leak to the pants and soil the pants. OK， 咁其實咧，我有好多堂友問我咧，佢哋就其實本身依家嚟講咧，去洗手間就其實咧係要去，但係咧佢去得係唔係好多嘅喎，但係佢啲人咧係只係2年嘅糖尿病，已經係喺呢方面咧係忽然間要去唔切，咁就漏啦。咁佢依家就擺咩啊？擺個紙巾喺條男仔嘅內褲裏邊啦。如果漏嘅時候，最緊要跌咗個紙巾啦，唔會整污咗條褲啦。女士咧就放喺佢哋嘅褲裏邊啦，又係一樣同一樣啦。咁其實都有一個好即係唔開心嘅東西啦。咁好多女士咧就話我唔去街啦，因為我成日瀨尿啊。咁其實咧我又覺得即係咪可以能夠解決到咧？係可以嘅。咁呢個解決嘅方法咧，我依家講啦。So if you really have all the time actually incontinent, one of the reasons is because you start getting high blood sugar in your system. And you need to really start taking steps to lower your A1C. And that result through your diet plan, you have the weight loss program, you make sure you're not excess weight. If you're excess weight, you know, a lot of weight on the tummy, it pressure on your bladder. So you got to go real quick. In other words, your tummy is so big, your pressure is so pressed onto your bladder, you really have to go, even with smaller urine, you have to go. Okay, so that is a few steps. Structurally, you have to do that, right? And on top of that, talk to your doctor early so you can prevent this occurrence. Now, so that is something that you have to do. Now, a couple more things you have to do. You have to actually, in the diet plan, you have to plan your amount of fluid intake. So what's that mean? In other words, if I know I'm going to a shopping today, and now I'm drinking Lowsutea, what you can do is instead of making a liter tea, and you can make it more concentrate. In other words, you can make only 500 ml or 16 ounce of tea, okay? And you cut it in half, but the concentrate is the same. So you drank, 125 ml, or I think it's 4 ounce before breakfast and after breakfast. So you got the same thing. Only thing, your tea tastes a little stronger. But you can do that. Now, we have a lot of our clients right now, they're diabetic, and they are also fluid restricted because they're dialysis patient. So net result, they can only drink, I suggest to drink only 500 mils for lunch and dinner. So they only drink 250 mil for the breakfast, 250 for lunch. So net result, they have limited, but the tea are just as strong. So they get the same effect, and they love it. So net result, so when you have not that many fluid in your system, the voiding will be minimized, okay? So that is so important to get less fluid. Don't drink so much before you go to a shopping mall, okay? 嗱，其實一樣嘢咧，你一定要繼續咧係降低你嘅血糖，因為你唔降低血糖咧，你個血糖咧係會繼續去影響咗你個即係神經系統，係能夠損害你個膀胱。咁呢個第一 step 一定要做，即係為降低 A1C 啊，咁啊整體要好啲嘅，其實呢個一定係嘅。咁仲有一樣嘢係降低你嘅磅數啊。因為當你肥胖嘅時候咧 ，your tummy is so big 咁大咧，咁就個肚咧壓落去個膀胱嗰度咧，就令到你膀胱係好少地方。咁就算你咩都好咧，其實你就會好快就要去啦。所以變咗其實咧，呢個咧係每一樣同樣嘅問題出現嘅。咁所以咧要降低嘅即係你嘅重磅啦，同埋要去做 exercise 啦。咁呢啲咧全部係要你去做到呢樣 weight loss 係 exercise 先可能夠降到 weight loss 㗎。咁所以咧係比較咁其實喺食物方面咧係點咧？譬如我知道咧，我今日要去 shopping mall，咁所以未必有廁所啦，係嘛？我有1個鐘頭裏面冇啦。 咁我要飲血糖茶降低我個即係血糖嘅喎。咁其實咧原本我哋係飲1個 liter 晏晝同埋朝頭早噶嘛，係咪啊？早餐、朝頭同晏晝，咁我係可能夠減低咗一半，即係用500毫升嘅水去焗1包茶。咁我只係飲250毫升 for breakfast 係早餐同埋喺早餐前後，即係每一次都係飲125 ml， 再加125即係250啦。即係未食早餐之前125，早餐後125，然後晏晝咧前又係飲125，晏晝後125，個早500啦。晚黑又一樣嗱，晚黑多啲喺屋企啦，可能嚇。咁但係其實個茶咧係唔會有任何少咗嘅作用，係一樣嘅，但係只係咧係濃啲嘅。咁其實飲咗落去咧，好多人都係覺得係好好飲嘅。其實都其實呢個點解會好重要咧？因為我現在有好多糖友咧，唔係只係糖尿病啊，其實佢亦都係一個腎病患者。咁佢哋係要飲好少水，咁佢只係晏晝同早餐、晏晝兩個加埋晒，就係500毫升嘅水嘅啫。咁呢個咧係當然咧係特別係做到呢樣嘢嘅。咁所以變咗嚟講咧，你又可以係幫助你咧係控制啲水喺個膀胱嗰度。咁變咗你唔使一定要去嗱。第二樣嘢咧，你真係要早啲話俾醫生聽啦，可唔可以做到幫助你去解決多啲嘅問題咧，係降低你嘅水。咁其實咧 planning 你去邊度有地方去廁所嘅地方係好重要嘅。咁同埋真係學你話齋 lose your weight 啦，同埋即係去飲嘅水係水分唔好太多啦。咁你就可以，因為你飲咗120即係250 total 毫升咧，去洗手間嘅時候，或者你未去shopping mall 去洗手間先，咁你就變咗你時間咧慢慢落去嘅時候咧，就唔會係好快要好急啦。Okay, so I have suggested that you drink like 250 ml, which is about 8 ounce, 250 ml, 4 ounce, well, yeah, 8 ounce. Total tea for 8 ounces of total tea for your breakfast, 125 ml, which is 4 ounce for before breakfast, 4 ounce after breakfast, so total 8 ounce. So before you go to shopping mall, you void go shishi, and so you let the fluid out, so you won't have that. So can you give me some of, I know, just tell me how many people have this issue. Give me a number two, to say, yes, I have this issue, that I have an urgency, I have to go. Can I give me a number in my screen, on a chat screen? Someone just give me that number, so I kind of know, are there a lot of people, they have urgency, they have to go, but sometimes it's not necessarily just urgency all the time. Okay, wow, okay, good. That's quite a few people, actually. Excellent. Thank you for your sharing with your information. This urgency issue actually is so common, and I have a lot of people actually come back and ask me the solution. So the key is control the amount of fluid take, lower your blood sugar. Okay, now next one. Now the problem for men a lot of time is really you have basically basically a lot of men is, wow, I have really problem because I don't have sex life anymore. It is a difficult subject to talk about, and same for me when I structured this, is also not so easy. But on the other hand, it's a fact, 30% actually of diabetic in Hong Kong have actually this problem. But in a way, in research, it showed that diabetic men have 3 times more developed ED than any common people. Okay, and in 2017 Diabetic Journal, half of the type 2 diabetic men in 2017 actually developed some kind of problem to get erection, and actually that's very big. And so this is something that we have to face it. You have to work with it, and I'll give you some idea how to do it. Now, diabetic 咧嘅即係糖尿患病者咧，呢個多數一定係糖尿患病㗎啦。男士咧有3倍咁多咧，係會有一個即係呢個勃起嘅障礙嘅，呢個係好 common 嘅原來。咁喺香港大概最低係30%啊，香港就有。咁然後咧就或者可能個 data 高啲嘅，但係好多人唔 complain 咁冇解啦。咁原來2017年咧喺嗰個糖尿患病嘅journal 裏邊咧，一半嘅男士咧係會有呢種嘅勃起嘅問題，尤其是 diabetic type 2啊，係勃起嘅問題。咁佢冇得勃起咧，咁就冇得 sex life 啦，係咪？咁呢個原來係好常有嘅。咁個原因係點解咧？就因為你知啦，勃起一定有好多血去到嗰個你個 penis 度咁然後咧你就先能夠可以有勃起噶嘛。咁冇得勃起嘅時候，咁你咪做唔到性嘅問題咯。咁原因就係因為咧你個神經系統嗰度係開始有 damage， 咁同埋冇咗 circulation 之後咧，咁咪勃起唔到咯。咁同埋咧呢啲blood damage 咧冇咗之後咧，咁你就好多時咧，因為冇得勃起咧，咁你就冇咗個性嘅 stimulation 㗎喎，即係冇咗性嘅desire 啊，咁血管影響冇得勃起啊，咁我做唔到就算啦咁。咁好多時咧，同埋仲有一樣嘢，好多時咧係有陣時勃起咗，但係就 maintain 唔到佢勃起嘅。咁呢個係好多人都有呢個問題。咁所以變咗嚟講咧，呢個係一個係要深刻要好重視點去做更加好咧咁嚇。咁我要嗱呢個咧就係常見嘅男士嘅type 2嘅問題。嗱，如果你 pre-diabetic 咧係唔會有嘅，係只係diabetes 嘅啫，即係應該係 diabetes 你就會要注視啦。Now, you may ask why I cannot have an erection. Well, the reason is because you don't have enough blood that go on into your penis. And on top of that, because your diabetes, many times your lower extremities are compromised with damaging your nerve. So your nerve are really not necessary being worked on. So net result, your nerve are being damaged, so you don't have, first of all, no erection. Second, because you don't have erection, then you are not going to be very easily stimulated when you have sex. And worse yet, you might erect a little bit, and very quickly you cannot maintain, you came back down. So net result, if you have no erection, your sex desire will be severe minimized. So net result, you cannot have sex. So this is something that you need to face, and the numbers is big. A lot of people don't realize. And a lot of people, to be honest, in Hong Kong, majority of my male patients do not talk about it. And they actually come to talk to me and say, I have a real issue. I only 4 or 5 years being diabetic. But on the other hand, now I have no sex life. So what good about it? You know, I'm very, very depressed. I used to have a good sex life, but now no more. Okay. 嗱，其實咧，我亦都要講下咧，其實有好多堂友即係都問我啊，喂，我好有問題喎，點解咧？其實我本身近時都即係性生活幾好啦，咁但係依家冇咗性生活喎，咁點解啊？原來咧好多人咧就話，嘿，我其實冇得勃起啊。咁如果你冇得勃起，就冇性生活啦。咁其實原因就係因為你係冇咗嗰個血啲去到個penis 度，咁你咪勃起唔到咯。咁其實呢個咧係好多人都有咁好多男士翻嚟咧就問我係好想有性生活，但係就冇嘅依家，因為勃起唔到。OK， 咁呢個係一個常見嘅好多堂友問我問題。咁其實咧就喺2014有好多 study 出嚟咧，已經話俾你聽，如果你有勃起嘅問題，同埋咧係點能夠令到好啲嘅性生活咧，有幾個方案嘅。第一，你真係要降低嘅血糖。第二，你要幫你個 diet 方面咧要好啲啦，因為有 diet 咧好啲嘅時候咧，咁你個血糖一定會降低噶嘛。同埋咧就要繼續去做多啲 exercise 啦，同埋要係去降你嘅磅數啊。原來磅數好有分別嘅喎。 如果你好肥胖，你嘅大肚墩阻住佢下低啲器官 circulation 唔好，咁你都拔起唔到嘅。原來咁同埋咧，仲有一樣嘢，原來食煙都影響，食煙都會影響你嘅拔起嘅，所以變咗咧你要戒煙咯喎 ，OK？ 咁其實呢幾樣嘢咧，你都係要開始咧早啲話俾醫生聽，我有呢個問題。咁醫生咧係俾多啲指引你去點做嘢啦。咁其實好重要咧，自己仲有一樣嘢要好注重咧，就係咩啊？要降低你嘅血糖，同埋咧喺 diet 上咧要真係用啲唔好食咁多有 carb 有碳水化合物嘅東西啦，同埋咧做 exercise 啦，降低你嘅重磅，因為你嘅大肚墩真係會影響嗰個即係press 落去個底下嗰啲所有嘅 organ 啦，所有嘅胰臟嗰啲即係 organ 你咁變咗咧，你就會令到你啲血去唔到嗰度啦，咁你拔起唔到。Okay, so very important. You really have to maintain a good blood sugar level, and the blood sugar level with that, how do you maintain better blood sugar level? Is basically is dieting, and a lot of people don't realize if you are overweight, it does press circulation to your lower part of the organ. That result, blood cannot travel to your penis, and that result you can't have your erection. And that is really sad, actually. A lot of people have that problem. And plus, smoking actually affect your erection. So decrease of no smoke. Basically, a lot of people have to quit smoking, okay? And you should actually share this information with the doctor, so the doctor can also continue help you to further understand how can they help you. So that is something is good to talk about, because also you might be also with other issue like urology issue, we might not know. So let's further open it up, and then you can able to understand what's need to be done. 嗱，咁另一個咧就係口臭啦。咁好多人就話點解會口臭啊？ So one of the issue is a lot of people say, wow, how come I have bad breath? You know, I don't understand, you know, why I have bad breath. So every 3 people in diabetes, they have some kind of gum disease. And gum disease is the gum become receding, and they also have red and tender, and they become very sensitive gum, sensitive teeth. And on top of that, there are more higher incidence of periodontitis, the infection of the gum. And so net result, the blood sugar also goes up, and it's not good for you. And so if you have infection gums, potential that gum infection might also go into your vessels, and net result, you will have even more problem occur. You don't want them to get into the vessel, because then you will get, you know, the whole systemic infection. And so net result, a lot of these people also have micro infection. In other words, they have because the blood is very sweet, right? And they not taken care of, and so net result, a lot of the bacteria start growing, and so net result, the teeth, once you have a lot of bacteria growing, you will have a fairly not good breath. And worse yet, if you are actually not, your body start burning your fat to convert in glucose, so you have ketoacidosis, which will cause a fruity smell in your breath. That's something you really need to concern, because that can be an emergency situation. I'll talk about a little while later, but that's something you have to look at it. You cannot just say, oh, forget it, I'm not worried about it. 其實咧，點解會口臭咧？首先咧，喺每3個糖尿病病者裏面咧，好多時咧都有呢個口臭嘅問題，因為好多時咧佢個牙肉啊，牙齒牙肉咧佢就會開始收縮，咁佢收縮嘅時候咧，好多時咧就有藏咗啲微菌落去啊，或者有紅腫啊，同埋啲牙齒更加係敏感嘅，咁會牙痛啊呢啲東西啦，咁同埋牙發炎係高咗嘅。咁變咗嚟講咧，好多時咧，因為呢啲咁嘅情況下咧，最弊咧，呢啲咁嘅發炎咧係當你有呢個發炎咧， 佢最弊咧係如果入咗血管咧就弊啦，因為呢個成個身體都會systematic， 成個身體都會可以感染到發炎嘅，由個牙齒嗰度啊。咁同埋仲有一樣嘢咧，好多時咧，當你係用糖嘅時候咧，唔係用普通糖喺身體製出嚟，你係用咗嗰啲 fat 你個肥脂肪係用糖出嚟嘅時候咧，咁咧你就有個 ketone 同類生酮類嗰種嘅 ketone 嘅味走出嚟，好似果味咁嘅。咁呢個要十分注意啦，因為 ketone acidosis 咧，即係話身體係生酮類嘅果味咧，咁呢個咧係可能咧係會令到一個好嚴重嘅後果嘅。如果你唔注意嘅話咧，你可以死嘅。呢個係OK，咁呢個要記住啊。So as you know, when you start getting lots of breath, so how can you treat that? So healthy mouth treatment become very important. So you really have to brush your teeth at least 2 times a day or 3 times a day, because you don't want to have all the micro items go into your teeth and start forming bacteria. Don't forget, because our blood sugar is very sweet. Any sweet people will say, the bacteria love it because they are just like getting more food, so grow more. So that has to be really taken care. And on top of that, you need to floss 2 times a day or 3 times a day after eat. The more important, you have to gargle. Listerine gargle, whatever, doesn't matter, Colgate, gargle 2 to 3 times a day. And you should see the dentist at least 2 times a year, not only 1 time a year, because you are diabetes, you have to more. So you got to make sure they see that your teeth are, wash, they'll, clean your teeth real well. You don't get bacteria stuck to your teeth. So all those are so important. 所以咧，其實咧好重要嘅，真係咧要幫助你去有一個健康嘅牙齒嘅管理。咁呢個健康牙齒管理係點咧？嗱，每日刷牙啦。最好就刷最低係2次啦，如果有3次更好咧，即係晏晝食完飯都刷到啦。第二，你要去用牙線去將嗰啲牙嘅床嘅東西拎走啦。第三，去 gargle 啦，啷口啊，好似 Listerine 啷口啊，或者係用個 Colgate 啷口，任何牌子都得嘅，但係一定要啷口。咁啊幫助你咧啷口咧就沖晒啲唔乾淨嘅東西，亦都有一個。如果真係有bacteria 嘅東西係能夠拎走啦，咁同埋咧，你每個年度咧，你應該睇2次嘅牙醫生，咁啊檢查咧你啲牙齒係咪真係健康咧？咁就去同埋 clean 啊，去洗牙 ，OK？ 咁呢個係重要嘅。嗱，最後呢個咧要好重要啦，就係因為咧其實咧，當你有糖尿病嘅時候咧，如果你係個糖係由嗰個fat 喺個脂肪走出嚟咧，咁咧佢哋就有個叫做有酮味啊，呢個生酮味啊，呢個酮味啊，酮味咧就係個 ketone。呢個酮味咧走出嚟咧，就好似有果味咁嘅。咁呢個酮味咧，因為嗰陣時咧，你個身體咧係有好多 ketone acidosis 啦。咁如果係咁樣嘅話咧，可能咧你就真係要去 emergency check 你係咪真係有呢個問題。嗱，個酮味就 ketone 個味咧就係好重要咧。如果你需要咧，就真係要去見醫生或者去 emergency 睇，因為如果你個酮味價率係高落去嘅時候咧，你會係 end up 會暈啦，然後之後咧就昏迷死亡嘅。咁呢個咧係要真係要注重 ，OK 就唔好唔注重啦。So I reserve this the last part you have to talk about is when you have a fruity smell, and that is meaning that you might have end up with your fat burning sugar out, and you actually will end up with a ketone acidosis, and that result, this is where you might actually will be in coma, end up if you don't take care down the road, and you can die. So you gotta really take care of that and go to emergency to find out whether you have ketoacidosis. Okay, so that's something that you have to remember. Okay. Now, Another one that a lot of people have toenails that become yellow and thick. And one out of 3 diabetic patients, if their glucose are not controlled well, it created a chance for fungus to grow on your toenail. And also another thing is the reason is because your white cells are decreases and don't fight off the infection. So net result, all that will create that fungus growth. And poor circulation to the feet due to your diabetes and also lead to osteomyelitis and high risk of a chance of amputation. I see a lot of these patients when I was ICU nurse. Actually, that is something that you really have to watch. And a lot of people say, oh, my toe is just yellow. It's not true, because if yellow, that's mean your circulation is bad, fungus will start growing, and you actually should see a family medicine to take care of that, or able to go to a podiatrist to really examine your toe. OK， 嗱，3個之中一個糖友咧，係如果佢喺血糖唔係控制得好咧，好多時咧係會有呢個叫做 fungus infection， 即係佢個叫做真菌啊 ，fungus 係真菌啊，係咁佢嘅有呢個真菌嘅 infection 咧係好 common 嘅喎，其實都咁，然後咧佢個血嗰個大個子宮咧多數厚啦、越黃啦，咁如果係咁講嘅話咧，佢哋真係要開始咧了解，喂係咪我真係要開始注重點去幫我哋 fungus 降低咧？嗱，降低 fungus 依家再講點解去做啊？咁仲有一樣嘢咧，係如果你嗰個血唔係 circulate 得好，即係血唔得循環得好咧，咁你個腳下邊嘅腳嗰度咧，有可能咧有骨膜發炎啊！當你骨膜發炎嘅時候咧，係唔會好咧，咁你可能就 end up 要腳咗個腳，哇咁好弊！其實好多糖友，如果佢係唔係控制血糖好嘅話咧，佢係會好多時咧就 end up 呢樣嘢嘅。咁所以變咗你一定要做多啲工作。第一就係如果你開始啲腳甲係開始黃同埋厚咧，同埋咧你就第一要真係揾你嘅家庭醫生或者你嘅足病醫生去睇你隻腳有冇能夠幫助你。咁呢個咧其實咧係最低限度每年有一次嘅睇呢樣嘢嘅。So if you are actually seeing that yellow toe start getting yellow, you really gotta get your doctor to help you, family doctor to help you, or podiatrist to help you at least examine your foot once time a year. Now, the doctor will basically most likely to examine your nails, see you have any infection, any injury, and also they will give you medication to apply tropically or oral medication to decrease your fungus infection. So they usually do that. And more important for yourself, you need to take care of your foot. Well, how do you do that? You have to put cream every night, moisturize it, no barefoot, no open toe and slipper, and take care your ingrown toenail. So that's something that you could do. And very important, you have to shoot, and I explained in a previous webinar, every night you have to actually examine your toe. Is there any kind of injury don't heal? And yesterday, I even have a lady came over. She have 300 plus. Her blood sugar is 300 plus, which is 17. And so end up, her skin condition is very poor. And I explained to her, I said, wow, you have to take care of foot because you notice her foot is so dry, little spot of infection here and there. So she is a very good candidate to what the situation just I want to talk about. So you got to be very careful. So 嗱，其實咧，如果你有腳係開始黃，個腳甲係黃厚咧，咁其實咧，你真係要開始咧，係幫助你自己咧，係第一去見醫生啦，腳醫生啦，同埋家庭醫生啦，同埋咧，你腳家庭醫生冇犀利嘅，睇下你有冇不同嘅發炎啊，或者損位啊，同埋仲有一樣嘢咧，佢可能俾啲藥你食，因為真菌咧要食藥，唔淨止搽嘅。如果搽唔得要食藥嘅 ，OK。咁但係好重要咧，你每晚咧 都要做一樣嘢，係睇你自己每晚嘅腳嘅情況，有冇發炎啦，仲要加啲好嘅嘅 moisture 啦 ，cream 啦，去soften 你隻腳嗰啲皮膚啦，就唔好着拖鞋冇蓋冚嘅拖鞋啦，同埋唔好唔着鞋啦，喺屋企行啦，因為整親腳嘅時候咧，你就會 end up 咧會損咗之後唔好咧，你就真係好大問題啦呢個。咁同埋咧腳甲咧，如果向內生嗰啲腳甲咧叫 ingrown toenail，你要注重啦，要點處理？咁呢啲咧全部咧你自己可以做到嘅。嗱，我問一問各位堂友，有幾多個喺呢度有嗰個問題 ？Can you give me a 3 if you see your toenail start changing color, and then you notice you also have very dry skin and some of the cracks on your foot. Can you give me a number 3 on the chat screen？ 各位堂友，如果你覺得你自己有咁嘅問題咧，好似隻腳又乾咗啊，隻腳甲又開始黃啊，同埋好乾啊，或者有少少損啊，或者俾個 number 3我喺個 chat 度 ，number 3我睇下有幾人有呢樣嘢。哇，都其實都有啲人有喎嚇 ，OK 啊。咁 anyway 嗱，我繼續講落去啦。咁咧第4咧就係、我哋咧有一樣好特別咧，嗱呢個亦都要好重視嘅，因為好多時咧女士尤其是女士喺嗰個即係嗰個你嘅私處嗰度咧好痕癢嘅咁呢個係即係一個好 embarrassing 嘅，因為成日都又拗唔到喎，又唔知點喎，哇好唔舒服。Okay, so one of the last thing that I would like to talk about, and is very, very common for many true diabetic person, is 75% of the women, they actually experience one time of some kind of yeast infection. And now when you have yeast infection, is always very itchy, because yeast infection is overgrown candidas, and so net result you will have your during the vagina area. So it's very itchy, as extremely uncomfortable, and you have to scratch it. You don't know how to scratch it. So net result, I think that's something that a lot of people say, "Wow, man, my goodness, I don't know." It's very, very irritating. 原來好多女士咧，喺75%嘅女士咧，都沒有一年都有一次咧，喺佢有個叫做yeast 嘅 infection， 呢個含珠菌嘅生長嘅。咁呢個 conjugate 叫 candidas 啦，咁呢個咧係喺個多數咧就喺個陰道嗰度會發炎嘅。咁其實點解咧？因為咧你呢個陰道嘅時候咧，你糖好高啦，咁亦都有好多即係糖尿高啦，咁有好多糖分喺度啦。咁呢啲就係又濕啦。咁其實咧依加埋晒咧係俾佢個菌咧係好多機會去喺陰道嗰度咧係好多生長嘅。咁呢個嘅時候咧，因為佢又濕。又熱，咁嘅生長機會高嘅時候咧，繁殖出嚟就好快啦。咁變咗嚟講咧，當你有呢啲咁嘅所謂叫 yeast infection 咧，其實咧係 end up 咧就會成日都會發生。如果你多過4次一年咧，你一定要揾醫生繼續咧係俾你藥你食啦，有個即係去查啦，同埋咧就多數係用抗生素去食去醫呢樣嘢嘅。咁好多時咧，醫生亦都俾因為可能呢啲又有真菌啊，有 antifungal drugs 啊，咁呢啲係幫助你係一定由醫生方面係俾你嘅。咁當然有 tropical cream 去幫你醫啦，但係重要點咧就一定要揾醫生。其實好重要咧，做一樣嘢係降低你個 A1C 啊。當你糖降低咧一個好嘅水平咧，呢個咧自然會降低嘅。嗱，其實呢個咧前期患病者有冇啊？都可能有，呢個係。都可能有前期患病者，因為如果你嘅血糖係去到A1C 係去到6.4啊、6.5咧，都有機會咧有多啲真菌嘅發生嘅，同埋有啲即係yeast infection 發生嘅。所以變咗嚟講，其實呢個咧，當你係就嚟 approach 呢樣嘢，你都要注重。So a lot of people don't realize if they are actually having yeast infection, they can basically, if you have 4 times a year have yeast infection, you not only on the first time you also have to go see doctor already, but more frequency if you have it, you gotta have antibiotic which is the antifungal drugs to help you to lower the chance of yeast infection, and then tropical cream to help you. The reason is because your vagina is moist, as wet, and as warm, and your blood sugar is sweet. So it really gives a very nice environment for the bacteria or the fungus to grow. So net result, you are much more easier to get fungal infection. So net result, you gotta be truly more focused this. And truly, also one more thing is even diabetic and pre-diabetic also have that possibility occurrence. Pre-diabetic meaning you are like your A1C is already reached 3 to 4. That is a time that you will have chances to get that coming up. And so the best thing is actually you have to better lower your A1C, lower blood sugar level, and basically net result you will able to improve that. So if you have fungal infection, talk to the doctor, get antifungal drugs. Okay, so in summary, you have to be one, you have to make sure that watch that if you have an unavoidable urge using for a restroom. So you really need to plan your meals, plan your drinks, lower your volume, or if you have places you're at home, so it's okay. But if you're going to a shopping center, plan your amount of fluid intake. And you cannot have an erection. It's important to lower your weight, stop smoking, lower your blood sugar, bad breath. You need to brush your teeth more, gargle, and make sure watch ketoacidosis. And if you have the toenail are thick yellow, you have to examine every day, put cream, and make sure that you don't have lots of dry skin, create infection, and wear closed toenail, closed slippers, don't wear Japanese slippers and get injured. And you have itch in a private area, so make sure you see a doctor, maybe get antifungal drugs to help you to relieve that problem. 嗱，咁一個summary 啦。就如果話真係成日要去廁所啦，咁你要 plan 你個 meal 啦 ，plan 你飲啦，少啲水啦，或者飲去涼茶就係飲250毫升，就每一次飲都係125毫升。做出嚟嘅時候，你用一個500毫升嘅水去焗個1包個茶咧，咁然後就分4次飲啦，每次飲就大概125毫升都可以嘅。個效果一式一樣嘅，只係個茶係濃啲，但係一樣咁好飲。其實我依家好多糖友咧係要去洗腎嗰啲，全部都係咁做嘅。咁第二樣嘢咧就如果拔起唔到咧，真係要減肥啦，唔好食煙啦，同埋咧就真係要降低血糖啦。咁同埋大肚腩減低個大肚腩啦，口臭咧就多啷口啦，去刷牙啦。咁同埋咧你個腳甲係黃色嘅話咧。咁你就真係要幫住咧，係點樣能夠係能夠即係睇下隻腳有冇損啊？每晚咧擺啲 cream 落去成隻腳啊！咁然後最後咧，我個即係底下嗰度成日都痕咧，咁你要如果係有 fungal infection 啊真菌 infection 咧，咁你就真係要去醫生俾啲叫 antifungal drugs 俾你食。OK， 咁多謝各位呢個，咁我哋依家咧就講一講咧。係點去做呢個其實呢個1.6克嘅碳酸化嘅花生醬嘅餅乾啦，就好好食嘅。咁我講到呢個就好特別啦，因為呢個大家會好開心點去做呢樣嘢。其實好簡單嘅，嗱我擺呢度咧俾你睇睇，呢個裏邊要做咩嘅配料啦。咁其實咧就係好容易，或者影張相先。So actually it's very simple. To do a peanut butter cookie is actually 1.6 gram carb of peanut butter. And it's very nice. The reason why a lot of people love it is because of the fact that it's so easy to make and also is a good snack. You can put it in the refrigerator after you make it, and then when you eat it, just put it in the microwave, heat it a little bit, and you can eat it. It's very hot and it's very good. But it's only 1.6 gram carb. I did a lot of lecture during the day. If I'm hungry, snack, that is what I make and what I chew on. So it's quite very nice. It's very, very satisfying and it's very delicious, okay? So basically, you make this with 2 cups of almond flour, a half spoon of salt, 2 tablespoons of sugar, and 1 large egg, 1 cup of peanut butter. You need to have a nuts peanut butter. I use chunky peanut butter, and then also you have just mix the ingredient together, and you bake it for about 10 to 12 minutes, depends on the oven at 350 degrees Fahrenheit or 100 degrees C. And to do that, you basically very, very simple. It's only 10 to 12 minutes. You get able to do that. Okay, so take a picture right now, and then I will go build the video now. Okay, take a picture. Hi, I'm Andrew Lowsutea president. Today we're going to do something very, very exciting because we're going to make peanut butter cookies. It's only 1.6 carbs, so you're going to have a lot of wonderful cookies to eat. If you eat 20 grams cookies, that's 1.6 carbs you consume. Hi, I'm Andrew Lowsutea president. 今日會特別咧，同你又再分享咧點做一啲叫做花生醬 cookies。哇，好正！你睇花生醬，咁係 1.6 gram 嘅碳水化合物。如果你食夠20 gram 嘅話，咁其實嘢好簡單嘅。其實咧，第一呢度咧有280 gram 嘅 almond flour， so it's very easy to make. That 280 gram almond flour。240 gram 嘅 peanut butter， 嗱，仲有240 gram peanut butter， so 240 gram of peanut butter, and then we have 6 tablespoons of erythritol， 即係6個 tablespoon 嘅 erythritol 啦， and then 113 grams of unsalted butter， 113個 gram 嘅冇鹽嘅牛油，同埋咧1隻雞蛋，1 egg, and then 1/2 teaspoon of salt. That's all. The ingredient is very simple. All we're going to do is mix all these ingredients into the bowl, and we'll mix it and make the dough, and then we just put it into the oven at 170 centigrade. We'll bake it. So 好簡單 ，mix 晒之後咧，然後擺入去一個焗爐嗰度就得啦。咁一陣間我而家首先咧就做咗將嗰啲almond flour 放喺呢度先。So now we're going to mix ingredient. First, I'm going to bring all the almond flour into this metal bowl. So we'll do this. Very easy to do. By the way, we already made quite a bit of very delicious snack previously. We did almond bread, we did cinnamon bun. A lot of people said that was delicious. We also did chocolate cake. Also, we already did coffee ice cream. Wow, that was delicious. So now this is going to be very nice peanut butter. So I'm going to make, I already put the almond flour inside here. Now we're just going to make the peanut butter into here so you can see how it goes. Just make sure you get all the peanut butter in. That looks really good. Yum, yum. Okay, then we're going to put the 6 tablespoons of erythrols. Okay, so we'll do it here. And then we're going to put the butter. And then, you see the butter? Is 113 grams of salted butter. So 而家用個牛油咧放晒落呢度，牛油所有放晒。And then we put the eggs. 一隻雞蛋，so the eggs. And then we do the salt. 依家鹽啦，一個 teaspoon 嘅鹽。咁咧就好簡單嘅啫，咁依家之後咧 mix 勻佢就得啦。So you see how easy to do? All we do just mix it well, you see? And then all you do just make sure you mix everything done. It's very simple. And also, by the way, 就咁 mix 落去咧，整下咧好似好 relaxing 嘅，因為其實咧今日咧我翻工都好忙，但係咧就you know 忙之中裏邊咧，如果你係咁做下嘢翻嚟又煮下嘢咧，哇好 relaxing 喎。So you know actually it's so relaxing because you know today you work hard and then when you come home the cooking is extremely relaxing。咁其實真係有機會煮下嘢咧係幫助你嘅。嗱，記住啊，糖尿患病者咧，如果你係成日好 stress 咧，其實對你糖咧都唔正嘅，因為點解啊？因為你個body個身體咧成日都會準備揾啲 adrenaline 出嚟，然後咧就準備同你打仗。咁嗰啲糖咧又出咗嚟之後咧，但係咧又令到你咧個 resistance 越整越高，咁啲糖入去啲細胞裏邊咧，咁你亦都有問題嘅。咁所以有 relaxation 都好嘅。咁 so it's very important to have some relaxation. If you don't get relaxation, you know what will happen? Your body is going to have adrenaline, and then it prepares you with all the sugar for you to fight or flight. And if you're high, just all the sugar is not going to your cells. It's not good for you. So all you do is just mix, and you make sure mix it well yourself. Mix it well now. Pretty much mix. So it's almost there. It's almost there. It is just make sure that you mix everything good. By the way, you see the cloth behind actually is made by my maid. Her name is Angie. She did it by hand. She said the wall looks a little empty, and she made it for us. So make our wall look so much better. Wow, she's so kind, so nice. It's good to have Angie help me mix this beautiful handmade stitches that she made in her own time. Okay, we'll just keep making, and it looks something like that. Looking good. Okay, pretty much, let's see, almost done. You see? All the powder's gone, and just keep mixing. It's look wonderful. Okay, good. Now what we do is now we mix. So what we'll do is this. After we finish our mixing, we're gonna bring our pan out. We'll stop the camera with it, bring the pan out, so we're able to start bringing the cookie into the pan. I'll show you how to do that. All you do is just get one little scoop like this, like that. You see one scoop, and put it down in this way. And then like a ball, and you press it, or use a fork to press it. That's one cookie. And you do this, do the same thing, and all you do is just pressing that, and you make, I think, 18 cookies around there. So, I'll start the camera now. I'm going to keep doing this until we fill up the pan. Hi, I'm back. OK， 我要翻嚟啦。嗱，其實咧，我頭先咧就一個 cookie 咧做好咗，就啱每一個 cookie 咧都有大概20 gram 一個 cookie 嘅，咁就啱就 1.6 個 gram 嘅 carb 啦。咁所以咧依家做好咗啦。So I'm back. So now you can see I just did all this cookie here, and you have 12 cookies, and each one is about 20 grams. And so it's very easy to do. I also preheat my oven. It's about 5 minutes. So when we go to the oven, we'll bake it for 12 minutes. 嗱，oven 咧已經 preheat 咗啦。咁我哋依家咧焗入去嘅時候咧，170度啦，170度咧焗幾耐啊？係焗12分鐘，12分鐘。preheat 幾耐啊？5分鐘。OK， 咁我依家放入去裏邊，咁然後咧就好快脆。有得食 chocolate 呢個 peanut butter cookie 㗎嘛 ，OK？ Good. So now we'll turn off the camera again. 咁我閂咗相機，然後一陣間再翻嚟睇下你嗰啲 cookie 搞成點。 Okay. Okay, I'm back. And you know, I've actually spent quite a time on making the rest of the cookie. I make 24 cookies, okay? So we will actually, we have the last batch now coming up. So I will show you how it looks like. 嗱，其實咧，我已經做咗總共可以做24個 cookies 嘅。咁或者可以做多啲啊，睇下你點樣去撳多啲出嚟啊。如果細嚿啲，咪多啲 cookies 啦，係咪？總之20 gram 嘅一個 cookie 大概20 gram 到啦，咁就係1.6 carb 嘅 cookies，OK？咁 anyway 啦，我哋依家開始咧就會做呢樣嘢啦 ，OK？咁我依家咧就攞呢個 cookie 出先，咁啊睇下嗱個攞出嚟 cookie， 咁啊俾大家睇下出嚟，最後呢班 batch cookie 就變咗咁啦，睇到幾靚仔 ？Okay, you can see I have been actually making the cookies along the way. So this is my last batch, the cookie, and this is how it looks like. And it's going to be very delicious, actually. So I'm going to try one of these and see how good it tastes, okay? So let's see. So see, it's delicious. It's very good. It's kind of chewy a little bit. And it has a cookie with peanut butter, nuts in there. So it is delicious. 其實好味啊，因為咧裏面咧有花生醬個花生啦，好味啦，同埋咬落去咧有少軟軟啲、韌地嘅，係好好食。咁呢個咧就係我哋嗰條嗱，仲有一樣正嘢喎，你可以飲 Lowsutea。一齊去享受呢個 cookie， 哇！真係第一個享受。So you can drink Lowsutea at the same time eating a cookie, low blood sugar, and enjoy life. I'm Andrew Lau. We'll see you next time. We'll try again. It's wonderful. It's really delicious. It's great. Matter of fact, it's great snack. And you enjoy it for afternoon or after dinner, just like a dessert. Goodbye, Andrew Lau. See you next time. Okay, I'm back. Yeah, thanks, Ann. You said looks very tasty. I think it is very good. Matter of fact, I have a lot of people loves it because actually I share this recipe to many people. They said, "Wow, tastes so good." So anyway, can anybody see me on my screen? Can you give me a 1 if you can see me now on my screen? See me? Anybody? Okay, good. All right. Okay, good. So now I'm going to answer some questions so you can throw in your question. You're right. And thank you for all the comments about making this. This is very delicious. And I have a lot of actually Hong Kong people, from Philippine people, from Singapore, Australia. They have tried this. They said they all loves it. And so I think in down the road, I will ask my Hawaii friends how they like this cookie. Because one thing good about it is only 1.6 carb, okay? So there's a question. Does type 1 have the same problem? 有一個問題咧，第一，如果係我係1型嘅糖尿病，係咪有同樣嘅問題啊？其實係一樣有嘅，一樣有。如果尤其是佢糖控制唔到咧，佢係問題都係一樣。所以呢個咧係就係 Type 1都要有呢個問題嘅。咁另外一個 question 咧就係if I need to restrict my tea intake, is it better take before or after meal？ 嗱，so 個問題就話，如果我唔想飲咁多茶，係咪更加好咧？唔食飯之前飲咧？其實唔係嘅，因為你飲嘅其實飲嘅茶嘅時候咧，其實你只係飲125毫升，未食嘢之前， 120秒成績都食飯食咗嘢之後，咁總共都係250毫升。咁你其實飲嘅水咧係少咗，但係茶嘅 concentrate 係冇分別嘅，即係你個濃度係冇分別嘅，即係唔係有分別，濃度係濃咗啲，但係一樣係即係個 efficacy 一個好處一樣冇嘅。So the answer for Eugene's question, if I restrict my tea intake, is it better to take before or after meal? Actually, you really have to take before meal and after meal, but you are now steep for the fluid restricted people. They steep the tea only a total of 500 ml for 2 meals. So each meal, meaning that your breakfast meal, pre and post, you only drink total of 125 ml or 4 ounce. So basically, you did drink a 8 ounce total fluid during the time you take your meal pre and post, because you need the pre. The reason is they block the sugar going to the bloodstream. Post, you need the guava. The guava will block the sugar in the bloodstream. Post is the bitter melon take the sugar into the cell. Only thing, the tea is a little more concentrated, but the actual efficacy has no different. It's still total of actually of 8 ounce or 250 mils, and your actual sugar. Your actual each cup is only 125 mil or 4 ounce. So net result of that, you have basically drinking the same amount of efficacy tea, but the fluid itself is smaller, only total of 250 ml per meal pre and post, and each cup is only 125 ml. The tea is a little stronger, but it just tastes as good. Okay. Another question is that, do you mean substitute eggs? I'm not sure what that means, but the eggs need to be there. Without eggs, I think the cookie might not taste as good, so you really cannot. So another question I have is, another question I have from Anne is that, can we only drink Lowsutea every day to avoid high sugar, not every day to drink? Okay, the Lowsutea is gotta drink every day. If you do not drink the Lowsutea every day, actually your blood sugar have a chance to go back up, because the residual effect of Lowsutea will be probably 1 day or 2. That's it. You'll be build it up, and you need to build it up. Okay. So once you don't drink, the second or third day, the sugar will go back up. So you gotta continue, because it's almost a natural thing. If you don't drink the Lowsutea, although it is not a drug, but you need to have the tea content to help you to block the sugar going to the vessels by the guava leaves, and also the bitter melon act as an insulin to go into the cells. So that way you will lower your blood sugar. So you don't drink the tea, you don't have that effect. So net result, you will not give you the efficacy to make sure your blood sugar will be low. I hope I answered your question. 如果你唔飲去糖茶1-2日咧，其實之後咧你糖就會上翻去嘅。所以變咗嚟嘅飲去糖茶係好重要，因為個原因咧就係、如果你唔飲去糖茶，你就冇咗嗰個番石粒葉啦，咁佢又唔會 block 啲 sugar 去個血管裏邊啦。咁亦都咧你個所謂嘅亦都冇咗嗰個苦瓜，好似一個胰島素帶啲糖入去 cell 度，咁兩個都冇咗啦，咁就去冇咗去糖嗰個作用咯。咁所以你一唔飲嘅時候咧，1-2日後咧，你血糖有可能去翻上去嘅。其實我而家好多糖友咧，其實飲咗去糖茶之後咧，個醫生咧藥都降低咗嘅。咁或者我遲啲咧有機會，或者阿 Ann、Mark 其他啲人咧，俾個 WhatsApp 或者email 俾我啦，咁我就可以 send 翻一啲我哋嘅病人嘅現在話俾佢聽嗰個情況。 So if you guys want to interested to learn a bit what my customer experience, maybe what you can do is also write to me either at the following address. I click the slides here. You can see right here it's Andy@wafong.com, ANDY@WAHFONG.com, or AndyDLau@gmail.com, ANDY and then a DLAU@gmail.com. I write it down on the chat window too. So that way you can ask me and I can give you some of the testimonial of the people that actually tell me how they're doing. That would be interesting to learn. Wow, you know, they drank the tea and end up they actually did not take the insulin anymore, or they lower the medication. One of them is actually Fei Mao. She has 20 years of diabetic due to gestation diabetic. She was taking 2,000 milligram of medication, mainly taking metformin, and that result now, after drinking 1 year of Lowsutea now, she only take one 500 milligram of metformin. And she told us Lowsutea gave her hope, because she thought that, oh, I have no hope anymore. I have to whole life. And now she actually take only 500 milligram metformin. Another patient of mine, who a newer patient, but you know, her blood sugar was actually about 8, 9 on Lowsutea, and on actually A1C. Doctor gave her medication, and eventually what she did is she basically, doctor eliminated her blood sugar medication after seeing her A1C drop down to 6. So the doctor slowly continue lower her blood sugar. Eventually, she actually starts saying, okay, maybe we'll see you can eliminate the medication. So we have many different people have different situations. So, but this is early diabetic, so that's a different story. But you are really already diabetic, maybe that's different. So, but if you have medication, you should continue to take it, and you need to take it until the doctor felt that you should not take the medication. At that time, you can not taking it. So it's all different people, different situations. So make sure to take your medication and drink Lowsutea. I hope I answered your question. 嗱，記住咧，一定要食藥，唔可以唔食藥，因為要醫生繼續係 monitor 你嘅血糖。如果醫生話你唔使食藥，嗰陣時你先唔食藥，但係繼續飲去糖茶，就唔可以淨係飲去糖茶就諗住唔使食藥，因為我唔知道你個糖係去到點嘅，所以同醫生講咧，我飲緊藥要一齊要食藥飲去糖茶，個 effect 係好好嘅。Another question is that I'm not diabetic now, just like to keep not high sugar, so I asked for not very day drinking Lowsutea. Actually, that's a very good question, and I have a lot of pre-diabetic patients. They basically actually drink Lowsutea basically just like a regular diabetic person, but sometimes because they're just started, so their blood sugar A1C is between 5.4 and 6, so they will drink at least 1 bag of Lowsutea with 6 cups a day, or and then see how it goes. But if their blood sugar doesn't go down, if the blood sugar continue goes up, you have to go back down to 2 bags a day, and then 2 cups, 1 before each meal and 1 after each meal. So net result, you will maintain your blood sugar level low. And a lot of the people who are not pre-diabetic and they are actually very healthy, we have a lot of those too, but they drank it as a detox drink every day. what they do is they steep one bag of tea for the whole day. Let's just use one bag and drink it. And the comment they have is, hey, my urine become much more cleaner. I feel much more cleaner. I feel really great, health-wise, seems like. And so they are feeling that they actually being detoxed. One of the very good things they will see is their urine become very clear and no very urinary smell, stinky smell. And they felt, wow, that's really good. And on top of that, the bowel movement also become better. So that's another characteristic that a lot of the so-called non-diabetic, pre-diabetic people who drank it strictly for detox, that's totally healthy. Oh, one more thing. They also said that the cholesterol start going down. Now, let me share with you this. This is a very interesting information. If your cholesterol forming with your high sugar blood, and you are only pre-diabetic or even starting forming diabetic, the blood become thickening. They start forming plaque on your vessels. So net result of that, the blood sugar is start going out. Plus, another thing is when your cholesterol goes up, your cholesterol will start damaging your pancreas B cells. If your pancreas B cells are being damaged, your blood, your insulin will not come out as much, or they come out as not as effective insulin to take your sugar into your cells. So it's really a catch-22. Net result of that, you will start getting less insulin, functional insulin. So as time goes on, if you don't do anything, you don't decrease your blood sugar, and your blood sugar, on the other hand, again, also damaging your B cells on the pancreas. So both items, cholesterol and your sugar, are damaging the B cell. So your insulins are not being functionable. So then you have more blood sugar onto the vessels. Net result, plaque are being formed, your blood pressure going up, and you still don't do anything. The next stage you have is pre-diabetic. And so I have been now educating people who have high cholesterol or moving the cholesterol up. I will ask them, hey, why don't you drink Lowsutea? Make your sugar come down and your cholesterol come down. So net result, you don't even actually become a pre-diabetic. So many of my American customer and Hong Kong customer are start doing that now. 嗱，講一個新嘅，唔係新發現啦，我都知嘅，不過就冇真係去強調一樣嘢。原來咧，你係個 cholesterol 加埋你嘅cholesterol 加埋你嘅糖咧，你係會兩樣嘢咧去 damage 你個胰島素胰臟嘅 B cell A and B 啊，有兩個 cell B cell boy cell 啊。咁呢個 B cell 咧 damage 咗之後咧，咁胰島素咧就唔會好咗出嚟啦，或者 damage 佢唔係咁 effective 啦。咁你冇胰島素嘅時候，啲糖就唔入去細胞裏邊喎。咁變咗咧越整咧，你就好多開始個血管亦都開始同埋啲血咧係變咗好厚啊，咁就可以 form plaque。咁 form plaque 之後咧，咁你就第一你咩都唔做嘅時候咧，你個 LDL 會高 up 啦。第二咧，你個咩啊？你個血壓就可以高 up 啦。你血壓高 up 嘅時候咧，你咩都唔做啦，咁你咧就會變咗好快咧就變咗前期患病者嘅糖尿病。咁你咩嘅唔做咧？3年後咧就變咗糖尿病。咁依家好多朋友咧喺美國同香港我都教佢哋咧，原來當你有呢個 LDL， 即係你嘅膽固醇 LDL 對心臟病嗰個 LDL 話唔好嘅話咧，你又要開始咧要飲去糖茶，降低你個 LDL。當你降低咗 LDL 之後咧，咁咧你個糖咧自己都會降低嘅。咁變咗你冇咗一樣嘢咧，咁你就冇一個即係風險咧，就變咗呢個前期患病者。OK， and I hope I answer your questions since you are not diabetic yet, but probably you are pre-diabetic. You need to drink your Lowsutea. Hopefully you can start it off and see. You drink 1 bag a day. Did it work? If not, you have to drink 2 bags, which means 6 times a day. But important, you have to drink it before and after meal. Before and after meal. Even you drink 1 bag, you still have to drink it before and after meal. Now, since you might not be fluid restricted, you can drink, a total of the 1 liter tea a day, and you can split it up in half, 500 milligrams, and see whether your blood sugar actually improve. But a lot of the people now they do the same amount of tea to drink to actually lower their LDL cholesterol, and that is very helpful. So I hope that, I'm sorry today we extended our meeting a little bit, and I hope that I have answered your questions. It's so wonderful and really grateful for you to actually spend your busy Saturday and Sunday listen to the webinar to better understanding the issue of diabetes or pre-diabetic or cholesterol. We'll talk a little bit more cholesterol in the future so you can have better understanding. We also going to talk a little bit more about disease process. Hopefully that will help everybody to better understand the disease process. And December 19th, we're going to have a professor talk about diabetic eye issue, because I found a lot of people really do not understand what problem they face in diabetic eye. I appreciate your wonderful question you asked. I hope I give you all the answer. And again, thank you again for the time. See you next time. Goodbye. Thank you.